Hola raza, welcome back to another episode of Psycho Uncensored. Before we get this show started, I wanted to give a shout out y I guess queremos dedicarle este programa a una viewer que teníamos, Tito el Chingón, as we knew him on Instagram. Unfortunately, he was going to be one of our guests here at Psycho Uncensored, and unfortunately he passed away. Y nos dolió mucho. It's something that pues en verdad no lo esperábamos. We were actually very excited to have him because we thought he had a very cool, interesting, es un chavo que no lo conocí personalmente, pero se veía que le echaba muchas ganas, lo seguía mucha gente.
Sí.
Y pues nomás queremos dedicarle este programa. Susie.
Yes, I wanted to say my condolences to Patty, his mom. We've been friends since elementary. And to condolences to his sister, Karina. I know that the way I found out was through their postings on Facebook. But Tito, just so you all know, he had a huge following. He was a content creator, and he'd let nothing get in the way. And he looked at life at a different view that we did. And he, con todo corazón, and he was a big fan of the podcast. And I remember his mom saying, "Can you give my son a shout out? He's a huge fan." And we decided to do something better, is to invite him and be a guest, because he was like a local celebrity himself. And he even traveled around the world, and I think he was in Germany when we talked for that. And then when he came back, he was supposed to be on the show, and unfortunately God called him to heaven. And just so Patty, we still have his shirt. We were gonna give him
y actually esa sweater that I was gonna gift him. Al poquito tiempo que yo me di cuenta es cuando se fue a Germany. So I was kind of planning, dije, no, pues si va a ir al show, like I'll give it to him at the show. I think that would be more special.
Yeah, that was perfect. And it was just so sad that when, he had just coming back, and then I saw that he was, I think, in a coma, and I called you and I told you, and I was in awe. And I believe you and I were going to meet him at the hospital. Yeah. We had set at noon, ¿verdad? And then that's when Karina had posted that he was gone. And I called you, and it impacted us so much.
It really did.
So
really did,
this is dedicated to Tito. Tito, yo sé que estás en el cielo y sigues siendo el chingón.
Para ti, chingón. Salud. Ringer.
Oh, yeah. I turned off mine. Because mine will ring or go off or something stupid.
Yeah. Windy? Are we recording?
We're recording.
Yo le raza, welcome back to another episode of Psycho Uncensored. I want to start off by thanking, like always, my official Psycho Uncensored sponsor, Rio Seco Ag and Supply. Thank you very much for your continued support. Y la bienvenida también a Susie. Ya tenía rato Susie que no venía con nosotros. So Susie, welcome back.
It's good to be back. Ya sabes que a mí me gusta el pedo.
I want to start off by also giving some shout outs to Jimmy Duke's Gaming Podcast. He does gaming videos. He does mic'd up sessions for fights that are happening here in El Paso. So go show him some love. Follow him on YouTube, Instagram, Facebook, all that good stuff. También Forbidden Acres is October 3rd. They're having their grand opening. It's on a haunted house here in El Paso. So also go follow them on social media to get more information. They're out on 13161 Tobacco Road. And it's definitely one of the best haunted houses here in El Paso. So go check them out. Also, también un special shout out a Bernie, the Middle Fingers Unfold. I believe he had cosmetic surgery, ¿no?
Sí.
Algo así.
No sé,
Algo era.
ya sabes que he's a rock star, so he's got to change his look, no sé.
Sí, algo así es. Debe de ser algo así. Pero anyways, brother, I hope you feel better soon. Y aquí estamos.
Get better soon.
Get better soon. Yes. Also, pues we got a very interesting show today. Mr. Shorty Almanzar, he's been here for, I think this is the third time.
Yeah.
Actually, you were my first guest, ¿verdad, Kana?
I think so, yes.
Yeah, he was.
Two of them,
if you go way back on the videos, Shorty era uno de los primeros, or the first guest, brother.
I was, because I think
I think so.
I did two with you already, so.
Y da vergüenza verlos porque, man.
Puro, entonces puro
if I suck
OG,
now,
OG.
Oh, boy.
Yeah, I said some real stupid stuff. But, anyways, pero I mean, aquí está Shorty. He's got some very good news for us. Y ahí está los shoutouts, ya están. Y bienvenidos.
Thank you.
So let's start off by introducing ourselves. And we have...
My name is Sylvia Almanzar.
My name is Marta Zepeda, and I'm with the American Cancer Society.
And I'm Vicky Melgoza. I'm just family.
I'm Shorty with Socorro Independent Writers. Everybody knows me by Shorty. My real name is Alfredo Almanzar Jr.
Also family. Aquí de
Yes.
Psycho Uncensored.
Yes, so,
Sí,
brother.
también familia.
Yes, sir.
Y Susie, pues no necesita introduction, Susie.
No, never, not, con la risita, ¿verdad?
Pues cuéntanos, Shorty, ¿qué nos tienes aquí de nuevo ahora?
Well, guys, we have another event coming up here, October the 12th, and it's Kickstands Up Against Breast Cancer in memory of cancer victims and survivors. It's going to take place over at the American Legion, Post 598 on 141 Ellsworth. We have a $20 entry fee for couples and $15 for single. We'll also be having a big dog food truck, guys. He's a good chef, el vato. Buena comida que tiene el dude. And if you need any more information, just give me a call, 915-503-8440. We also have $5 raffle tickets. First prize is $800 in cash, guys. So, I mean, it's worth $5. Second is a 70-inch TV. And we'll also have door prizes, and the DJ Miss Fee is going to be playing there. So come out and support the cause. Everything that we make will be going to the American Cancer Society. Pero with that said, Joe, I wanna thank you for having us here. This is, I guess, the third time.
Yep.
I think so. And thank you for having us, man, and helping us out in these events that we have.
No. Gracias a ti por darnos esa confianza de hacer promote tus eventos. I've noticed that a lot of events have to do with supporting the cause cancer, breast cancer. Tell us a little bit why. ¿Por qué te enfocas así en eso?
It started a long time ago, but I can't go that far back. Pero seeing my tia, this is my cousin Vicky here, her mom, she passed away from that. We had an event for her, but unfortunately she didn't get to make it. Pero that was one of the reasons, and just seeing people suffer from that, children as well. I mean, pobrecitos.
Yeah.
I mean, we've helped a few kids around the community here. And it hits the heart, man, and then we just continue doing it, man. People will reach out to us, and we can't tell them no.
Yeah.
We can't tell them no, and we just go ahead and we do the event, man.
It's what Shorty does best, definitely with runs.
Thank you.
I think all your runs have been a great success. You're very humble. And then, plus to wife Terry, she's a great support to you. And I know that you guys are well known through the biker community, helping out the community, and that's a great thing. So
yeah, she pushes me hard, and thank her for always being by my side and helping us out in these events.
Push her back, Shorty. No te dejes.
Oh, yeah, ¿verdad?
Sí, no te dejes. Así
Vamos a
comienza.
empezar a pusharla para atrás. Ándale.
No te creas.
Now, I have a question, Vicky. I know your mom. He was saying that your mom had passed away. Was it breast cancer, or did it start there, or tell us exactly what happened?
So it actually started as breast cancer, and that was back in I want to say 1996. So she was a cancer survivor, breast cancer survivor for 19 years.
Wow.
She surpassed it, like we were talking earlier, going through remission and going through all that craziness and the what ifs, if it comes back, whatever. So she was a warrior. She fought, she made sure that her face was always smiling. So granted, 5 years ago, she ended up having stomach cancer. When we found it, it was too aggressive. It was already at stage 4. So unfortunately, she did lose her battle. It'll be her 5-year memorial next Saturday. So
Sorry to hear that. And do they think that it was maybe stemming and it started from the breast cancer, that maybe a root there or something? I mean, I'm not too sure. Maybe you can speak to this, how that works. But do they think that maybe it may have spread a little bit, something that maybe was not caught and got to her stomach?
I mean, granted, I'm not a doctor, but he did tell us, which is her oncologist at the time, he says that it's a big possibility that they sleep. Those cancer cells sleep.
Yes.
Sometimes they don't go away 100%, and with time, and then, of course, I feel like the history of the family has a big issue, too. And unfortunately, a lot of her family members passed also of some type of cancer. So I just think that with all of that in question, like, it just made it more of a reason why it came back.
Okay. And we were talking earlier about doing the cancer gene test, because it does exist. Because your family has a lot of history, have you all been tested, and how accurate is that?
Well, my sister and myself, we did get tested as soon as we found out that it was at stage 4, and her doctor, he did recommend it, being again with the gene of the family. Thankfully, my sister and I didn't have the gene, but of course, like they told us, it doesn't mean that you can't get cancer, right? But at least we're able to take care of ourselves a little bit more, getting the screenings done and whatnot. So
A little bit of peace of mind también, ¿no?
Yeah, and that's good that you mentioned that, because I think a lot of people, the misconception is, I'm going to get the cancer gene, I don't have it, I'm good. But like you're saying, it doesn't mean that you're good. It just means maybe at that time it's not showing up, correct?
Exactly.
Maybe, Martha, you can explain to us how more that works, and what I was asking about, and what we were talking about, that they sleep and they're dormant, and there is more that causes that, because a lot of times, and you would know that it starts off with a cancer here, and then all of a sudden you have another cancer. I know I have family history too, and my father started with prostate cancer, and I heard you talking about that earlier. So, and it started off like that, and then he ended up getting colon cancer, which it stemmed from that. So can you explain to us how that works?
Yes. So I think that there's a misconception that cancer only comes from genetics, right? And so what we need to understand, it's not only genetics that actually can progress cancer cells in our body. It's also our lifestyle. And so many times when we see a survivor, and, and I see it often, I've been with the organization for 19 years, and, seeing a survivor thriving, and, you're seeing 20, 25-year survivor, right? And then some younger survivors, 5 years, 7 years, they're like, well, wait a minute. She went, 25 years, and here I am with the second stage diagnosis. But we got to look at the factors, of course, if the patient is actually seeing their doctor as follow-ups, right? Because that's also contributes. And you will find that some patients don't go for their follow-ups because they're scared to hear the word cancer again. And we were talking about it earlier, like survivors, it's sometimes harder because it's a mental drainage to keep thinking, am I going to get cancer again? Am I going to get cancer again? So it's draining for them, right? And so That is the hard part, but it also has a lot to do with the lifestyle. You know, if they're physically active, nutrition, it has to do with, you know, even taking medication that their doctors are being prescribed, you know, because you'll see some patients that will deny it, and for their own reasons, right? Because everybody won't know exactly. But every patient is very different. So you see a lot of those factors when it comes to that. But I'll give you a fact that you know that when someone is diagnosed, someone who has a history of cancer are more likely to go get checked because they know that there is
Yes.
someone in their family that has been affected, right?
Yes.
So you want to run out there and be like, I want to go get checked because my grandma, right, my abuelita.
Yes.
But then
I agree.
you'll see someone who thinks there's no cancer. You just mentioned right now, there's no cancer in the family, and they have a late stage diagnosis because maybe there were signs, but the mentality is cancer doesn't run in our family.
Right.
But there is signs, and they just sometimes, as human beings, we choose to ignore them because it's like, you know, especially in the Hispanic community, it's like,
Yes.
you know, échate Vicks,
Ponte
yeah,
Vicks.
yeah, vente Vicks, tómate una Sprite, yeah, you know, burp it out, whatever, you know, una espalda, y whatever. So we don't see those things,
don't.
and they're clearly there. The signs are there,
Yes.
and that's the hardest part, I think, like you said, because people say, pues, ¿cómo le pasó? You know, how is he, you know, in this stage 3, you know, wow, yeah, you know, ya no tiene remedio, how they say. But it happens because if you ask that person, there were signs, and they were just choosing to ignore them. I know in my dad's case, that's what it was. He literally, he kind of knew, but was pushing this. He already had his prostate cancer. He had already gotten it removed. And as a man, that's very hard on a man. And, you know, Latino man, you know, and he was in his 50s. It's like, oh, no, you know, not me. So he ignored it. He didn't do his follow-ups, and that's where it came from. And then when I saw him and I forced him to go to the hospital. I didn't give him a choice. I kind of knew too, but I was hoping we were going to catch it on time, and no más me duró un año, you know, and then he passed away. So yes, it's the awareness, I think, when we need to bring to the community and out there, and not be embarrassed, especially to the Latinos, you know.
Yes.
You know, the machismo's got to go out the door. You know, your family's worth more. You know, throw your pride away. Yeah. Throw their pride away, and then think of, you know, what it's going to cause the family, the dynamics of it. I think, and that's also what we have to talk. Yes. And that's where you both come in. It's, you see what the family is going through, that family member, and, you know, if we can prevent it, why not?
Yes, definitely.
I think it's also, como in my case, the fear of just getting bad news, you know, like, how common is that? Or how can you, you know...
This is how common it is. 1 in 2 men will hear the word cancers, and 1 in 3 women will hear the word cancer in their life.
Wow.
So that's some statistics to look at.
And that's a big word, because it's a scary ass word.
Yes, yeah. I know, and like for me, like I said, now it never ran in my family until now, so I'm constantly getting checked for the colon cancer and whatnot. But one of the biggest scares was actually at your run. I had talked to Melinda, and when we were doing your run, we had just done the show, and I had gotten a diagnosis of, you know, they found my mammogram came back abnormal, and I was like, what? That we don't even run in my family. And I asked, and then my mom says, oh, pues sí, una tía de ella. Like, it was very far, you know. She's like, well, I didn't think to tell you, and it was very agonizing, because I went home and I felt that, and I was like, oh my God, they are there. And it was agonizing waiting for the biopsy to come back. And I remember that Melinda, your sister, was there for me. And she's like constantly messaging me and telling me, you know, have you heard anything? I'm not yet, you know, but it was very agonizing. And, you know, they put the clips on there, and I still have to be going every 6 months. This is something maybe nobody knew. I didn't share this before, but I wanted to share it here. I don't think you even knew that.
Well, exclusive.
Yeah, yeah. And so when I got the diagnosis, it was it was benign. it was a big relief. But they told me, but you're not out of the door. They're still there. They found some more. They're still monitoring. So every 6 months I have to go. So I keep that in the back of my mind that I got to go. And like you said, just, if I can catch it on time, my chances increase that way. So yeah.
And I guess now is more, yo me acuerdo que antes, the word cancer wasn't that big of a word, at least that I remember. Like antes nomás se oía, que a fulanito le dio cáncer.
Sí.
Oh my God.
Sí.
And now it's like, it's hitting every
Yes.
household.
Everywhere.
Every household.
But they say it's, like you said, nutrition, what's out there, all the hormones that the food has,
But the reason why it's more common now and you see a lot more people talking about it, it's because it's not a death sentence anymore. So if you look at it, before, we didn't have that many,
the technology.
Well, the technology, the medicine, the different type of treatments. And, as the American Cancer Society, we're the #1 organization to fund research, and I'll name you some just in breast cancer that we're looking at right now. We have an enormous, and most of our funds go to research because that's how we develop new studies, new treatments, new medications that have saved so many. So if you look at the patients diagnosed now, well, not like now, right now, right? But like in the past recent years, you'll see more survivorship than you will deaths because of the technologies that we have, like 3D mammography, things like that, So there's a lot that has been done
with that. And then, so I know you said you were with the Cancer Society in 19 years. What got you involved in it? How did you get with the Cancer Society?
So I was young. I was 23 years old. And it was one of my really good friends. And I used to be a medical coder. And it was a very boring job. I like to
It is,
talk.
actually.
You don't say.
I've known. It was. I'm sorry.
You can't be behind the
I
scenes.
know. I knew it was not my calling, but I had to pay the bills. No, but I was a young mom, and so I got the opportunity to go and work as a more like a secretary, helping patients get like transportation and support groups and things like that. And little by little, I started growing with the company, and I just found a passion. And I always said, God, give me the strength to be able to cope, because it was really hard for me. I would go home crying. Patients that would come to me goes, Mija, yeah, it's my last day. Like, I'm no longer going to be here. Like, it was very draining for me mentally, emotionally, And I said, please, just God, grant me the strength to go through this, because it's very impactful.
Yes, absolutely.
And so I've been there since. And the same passion I saw before is the same passion I see now, 19 years. October 3rd will be my anniversary, And
happy anniversary.
Yes, in October. So nice. I love what I do. But I think what it is also is I love the impact that our organization makes, not only in our community here, but around the United States. But also, what is more impactful? People that work like Shorty and Terry, that do these events to not only raise funds, but to raise awareness.
Yes.
And the impact that they make in their community. That's what brings me to a full circle of joy, because there are people that are out there to support and help, regardless of, what nonprofit. Because I tell people, we're all in the same game, guys. Mm-hmm. Let's work together, because our patients need us. So.
And tell me, so if there's somebody who, and there's going to be plenty that are out there that are listening, people who don't have insurance, and maybe they're scared, number one, they already got the diagnosis. Now what do I do? I don't have medical insurance. I don't have the funds, to get treatment. What would be your advice as the first avenue to take?
So that 60% of our community is uninsured, and probably even it has gone up a little higher, because after the pandemic, a lot of people lost their jobs, right? And so one of the efforts that as the American Cancer Society did, we took a huge impact through the pandemic, but we were able to refocus. And now what we do is we provide grants for screening across the nation. In El Paso, we have screening grants to help those who are not insured. So that's one avenue that we support within the American Cancer Society. But another avenue is partnering with, like, for example, the American Cancer Society is a nonprofit organization, right? So it's not a medical organization, but we work with hospitals, treatment centers, federally health qualified centers, which are more towards patients who don't have insurance or are uninsured and underserved. And so we work with those programs that they have to be able to get those patients to get screened. So for example, Texas Tech, and we have a sister company, which is our lobby company. We also lobby. We are the voice of patients, and survivors about their journey and what we need to change, right, in our legislation. So we have that sister company. And so we were able to fund what's called CPRIT grants, and it's only in Texas. And those funds are to help support communities that have high uninsured rates of patients who can't get screened. So we currently here have a breast, of which is mammogram, to screen for mammograms, cervical to get their pap smears, colorectal, and then we also have HPV vaccination for kids, and that's a totally different story, another topic. But that's what we are here to support. So if they don't have those resources to go get screened, because that's our main goal as within the American Cancer Society is health equity. And what does health equity mean? Making sure that everybody has the same format of getting treatment, of same format, whether you're insured, whether you're high class, you earn hundreds of thousands of dollars to earning the bare minimum. At the end of the day, cancer does not discriminate.
Absolutely. So would
Doesn't
you
matter
say
how
that
much money you make, how old you are.
Absolutely. But so would you say that? What about those that already got diagnosed. and they to say that, I don't know, they got sick, they went through the channels, right? And they told them, they gave them that news, and they still don't have cancer. I mean, I'm sorry, they still don't have medical insurance. What then? Because it's like, okay, now their doctors are telling me I need this treatment, I need to get surgery, or I need radiation, but where do I find the funds?
So we do get patients that get so this is a really cool part about it. So one of the parts of the navigation program that is also in partnership with a lot of these hospitals, and we have our own navigation program to train navigators how to navigate them through the process. Because as you know, as a survivor, right, it's not easy. Where do I go next? You hear the words and like, where do I go next? Like what? So the navigators navigate them. But where does it start? They get screened, right?
Yes.
And then they refer them to whatever best program fits for them, whether they might have an insurance with high copays, right? And so we navigate them. Most of them go through the county hospital because they have a discount program. And they provide those funds through the county hospital to get treatment. So most patients do go through that system. Because the other hospitals are for-profit hospitals, right? Most of them, you have to have insurance. So most of those patients who are uninsured go through University Medical Center. So there is a program that they offer for those patients. Then from there, the American Cancer Society provides the support to help them not delay their treatment. So for example, transportation. Patients sometimes can't even drive. So we offer transportation to our hospital so that they cannot say, I can't go to my life-saving treatment because I can't find a ride.
So the patient advocates are the ones that are actually that they're helping them get through step 1, step 2.
Yes.
They're calling them constantly. Oh, yeah. And that's, we have a lot of listeners also from other places. So they would go to their doctor, they would go to maybe their county hospital that would probably be, within the funds. So it's the same thing, not just here in El Paso, but because she's talking about a local hospital here, but I think that's for everybody to know. It's their county hospitals, that work one-on-one with the American Cancer Society, correct?
Oh, yeah. Oh, yes, most definitely. We work with all healthcare systems, and we work with health plans as well on state levels across the nation. And what does that help? It helps our health plans tell them, where are your patients getting screened? Why are your patients not getting screened? Because believe it or not, the worst people that don't get screened are those who have insurance.
Yeah, that's true. You have it all. It's just there para pasi las moscas. It's just there, but you don't realize that. But it's there, so you can go get checkups.
And most insurances have like an annual.
Yes, and there's no fee.
Screening.
You don't even have to pay the copay because it's part of it, so that you can go get screened, get your blood work. Como se dice, un health assessment. Correct.
That's exactly right. And that's what we do on a state level. So we work from a national level to a state level to a local level, so we work in all aspects. But that's why we do what we do with health plans.
Yes.
Why are your patients not getting screened? And let's work on a plan to get them screened. Let's start messaging them. Let's start talking to providers who accept your insurance. Let's talk to them about why are your patients not getting screened? Because believe it or not, that's the case. Insured patients are the least to get screened.
Now, Sylvia, I know this is your 1 year anniversary. Tell us how your journey started, and I know, did it start actually a year ago or a little bit longer?
Actually, it was a little bit longer. I used to work for Desert Imaging.
Oh, wow.
So I worked in the mammogram department, sending out the letters to the ladies that needed to come back for additional imaging.
Look at that.
So I never thought I would be one of them, because back then you would only hear of the patients getting cancer when they were already past menopause. So when they were already like in their 70s or 80s. And then it started to where they started getting it in their 50s, right after menopause. So I had an abnormal mammogram when I was 39, and that was my first mammogram. But I wasn't worried. I thought, well, because of the fiber and all that, and you're young, and so it was normal. But I did go back and get checked, and of course it came back normal after that. But then knowing that I had cancer on both sides of the family, I knew that I had to get checked. And so I went and did the test, the gene test since then. And mine came back that I had the gene. So I had been getting checked. Every other year was a MRI.
And that you were talking about the breast MRI?
Yes, the breast MRI.
Okay.
Yes. So, and then of course, like maybe 2 years ago, I felt it started off with the inverted nipple, right? So, and then from there, I knew that there was something. But they did the MRIs and they kept saying nothing. There was nothing.
There was nothing
there.
See, that's a great example of somebody still going and checking and doing, their due diligence of checking themselves and still coming out positive for that. When they told you, what stage were you in?
Luckily, I was a stage 1.
Oh, good. Gracias a Dios.
Yes.
What happened, like, after you were told, like, you're positive? What's the steps that happened after that?
Well, when I went back and they told me that it was after my pathology, they told me that it was positive, which I already figured. I felt it already. Yeah. So I knew that, it was going to be positive. So once they told me that, I didn't get scared or anything. I guess seeing all those women that went through all that before, I guess that kind of helped me.
Yeah.
So I just embraced it. And I said, okay, well, if that's what it is, then, we're going to fight through this. And I know my family is going to be there for me. So it helped me a lot with them there.
And that is, Martha, you would know, family support is a big thing. When you have the support system behind you, being there for you, helping you, take care of you, because I know, like with my dad, I took time away from my job. I quit my job, and I wanted to take care of my dad. It takes a toll on everybody, and the more family members, the better. But I really truly believe in that. Really helps the outcome, because here we are a year later, we're talking about it, and you look great. And I know that your family, look at this, is a big support here. So congratulations for having that. That's beautiful, you guys.
Speaking of family, I think that when a family member gets diagnosed, like it takes a toll on the family too. Is there any help for the family? How do we give that support to the family member? Like I wouldn't. How does that?
So I think when you're going through someone who's affected by cancer, we forget about ourselves, right? At one point, you forget about the person who is a caregiver, and speaking as a caregiver, you have to take care of yourself mentally, physically, and emotionally, right? It's a big thing. And so with the American Cancer Society, we do have caregiver support, support groups for them. We have a cancer.org website, and let me tell you, you can find so much help during that camp. Whether you're a patient, whether you're someone who wants to get screened, whether it's someone who's a caregiver, whether it's someone who's, a survivor already, because the effects after, survivorship, let me tell you, are just as tough as going through treatment.
Yeah.
What is that website? So we can
cancer,
put it.
yes, www.cancer.org.
Cancer.
And the really cool part about that website is that you can chat with someone live.
Wow.
Like there's an
24/7?
24/7.
That's amazing.
You can chat. Some people don't want to call. Some people just are still timid, right? Or don't want to share their story, because you do see that. And it's still a stigma for a lot of patients. They don't want to share their story. Sometimes they don't even want to share their story with their own family, because they don't want to be a burden. Exactly. And so, so imagine what a caregiver goes through, that burden, which you don't, because you're there to support them. You're in a much better health, right? But it's hard. It really is. And we do have programs and services for caregivers as well.
So that's another way that the Cancer Society, when the funds that are raised with these kind of events that Shorty puts, that's where this money is going, you all, is for that 24-hour, because somebody's got to be sitting at that typing or talking to somebody. So that's where the funds come in effect. So this is the reason why it's an amazing thing, Shorty, that you're doing here, because you keep it rolling, so that there is an opportunity for somebody else that may need the help.
Yes, and a lot of this, the community gets involved, and they're the ones that bring in, the money, the funds for the actual patient. And I'm really glad that Martha's here, because she's got so much information. That,
yes, absolutely.
And this event that we're doing, it caught us kind of off guard, because we had just done an event. But next year, for sure, we're going to make it bigger. And she's got some other plans that she's going to bring in.
Looking forward to it. Yes.
So,
so this is the first annual.
This is the first annual. Yes.
Ya, para que sepan, raza, ¿eh?
I heard some interesting topics. I'm sorry. Cuando I guess you went live, Shorty.
Yes.
Even for the men, right?
Oh yeah, I heard that's going to be your next topic or your next event, and I think that's going to be a great thing. Is there going to be like screening or I mean, for a lot of people who are unaware and how is it? How do men get screen nowadays? Porque the stigma. No one's putting anything up my butt. Que sabe qué, Ay, me va a estar tocando y sí, But they don't realize that that's not the way they do the screening.
Bueno,
at least not anymore.
No. I mean, I asked my doctor. Le dije, how accurate is? Porque según ya todos dicen, hay blood work. Ya si haces lo otro es porque eres mañoso. Pero dicen que el blood work is not as accurate as the actual,
exam.
But
I think they come hand in hand, don't they?
They do. The thing is that it reads your PSA levels. And so that's how it can determine. But you do want to get your prostate,
I'd rather be safe than sorry.
Yes. But a lot of men, believe it or not, a lot of men don't think that way. So a lot of men don't want to go get checked. And you know that actually that's the number one cancer for men is prostate?
Yes.
Right
I
now?
believe it. Mm-hmm. I believe it.
It is. And you know that, looking at what, Shorty and Terry are doing with this walk, you know that also men get breast cancer?
Yes.
That was one of my questions.
Yes.
Porque, I mean, uno que está gordito, pues tiene más pechuguita, ¿eh? Shout out to Linda. Shout out to Linda, que ahora no nos está ayudando, pero le gusta jugar con ellas ahí. A la Linda. So there is screening.
Yes. Yeah, there's men that get cancer.
So should I be examining myself in the shower? Or?
Well, you know your body. And I tell people, us, men or women, we know our bodies and we know the difference, right?
Yes.
So if there's a change, some sort of discomfort, by all means, you have to. So there's roughly 2,700 men that are diagnosed of breast cancer in the United States every year.
Wow, that's a huge amount.
2,700.
No, it was me. It was me. Sorry.
That's a
Es que
huge
me
amount.
asusté.
Yes.
He's like, Linda, tengo que ir a checarme,
Ahorita,
Linda.
hey, ponle break ahí, güey.
And out of those 2,700, roughly about 500 men die from breast cancer.
Wow.
Because, but the reason why is because you never think that
Yeah.
men get breast cancer.
Yeah.
But that's the great part about, this event is we're bringing awareness,
Yes.
things that our community might not know.
But you know what? I've never heard awareness for men breast cancer.
Well,
Where's those runs?
Well-
Shorty.
I'm thinking about it now, and I think we're going to include that for next year. I mean, I think it would be a great idea. I mean, with this coming out, and bring all the biker community out there.
See,
Where's the
and
free
get
screening for
checked,
men?
See, yes.
Yeah.
And at this event that you're going to have October 12th, are we going to be doing any screenings at all for something?
so we don't have a van, a mammo van. It was a little bit of short notice, but for next year we do. That does not mean we're not going to have the resources for them to get
Wow.
information about where to get screened and where to get. And again, like I mentioned earlier, breast, cervical, colorectal. That's another topic too about colorectal cancer.
Yes. Yeah, absolutely.
Right.
Different tests.
But yeah.
What are some signs of that?
Of the breast cancer?
Or I mean, you mentioned right now that you feel it. Like, I mean, what
Or
do
like
you
she
feel?
said, the inverted nipple. That's,
Yes. You feel lumps. Like when I was working at Desert Imaging, there was a lot of men that were coming in with breast cancer. And back then it was said that it was a lot of the truckers because they were
my
sitting
God.
so much.
oh my,
Chichón,
yeah.
troquero.
Yeah.
Hombre.
Ya sabes,
Ya
Joe.
más quiere, Joe.
Paga el show, vámonos. Let's
Ya
go
vale
get him
madre.
checked.
Págale ahí, güey. Vámonos.
Yes, back then that's what it was said. It's a
But
lot of
why?
truckers.
Why truckers?
Because they were sitting so much, so there was no exercise,
No
nothing.
activity,
Yeah,
and that's where she comes in, where she says
Yes.
the physical life, being active. You
Yes,
know,
moving around.
So get off the couches,
Bueno,
guys.
bueno.
Ándele. Another reason why to get off the couch.
Yeah.
Like for survivors, what is a healthy diet, or what you mentioned also that you need to take care of yourself. What are some steps that, I mean, what do you do to maintain a
Well,
healthy body?
I eat a lot of chicken, but I stay away from red meat.
Red meats.
I do. I stay away
I
from
don't.
red meat.
I
and,
don't.
And that's what I tell him. We need to stay away from.
Regáñelo.
Tell her I eat a lot of chicken y hasta plumas me están saliendo. Pero,
But it's
But-
healthier for
yeah.
us.
Pues switch it to
It's
fish,
healthy.
hombre.
Yes,
it's
fish.
healthy.
You
It's
know?
healthy. We got to do that.
Yeah.
Yo tengo una pregunta. Escuché años atrás de que en Asia, pues el cáncer de mama es bien bajo. Y me dijeron que muchas veces puede ser por la leche, que ellos no consumían nada de leche y que en Estados Unidos, pues era todo lo contrario.
So
¿Tiene algo que ver eso? ¿Es cierto?
it could be, puede ser. But let me tell you, the incorporation of vegetables with them, and it's a lot higher than us. So you know that the United States has the most consumption in processed foods.
Yes.
There's processed foods in the
Oh,
United
my
States
God,
that
yes.
are not even legal in other countries. You go to Europe and it's like, no, right?
Yeah, what sausage?
Yes.
En veces dicen que hasta las hamburguesas de McDonald's saben diferente. Like it's not the same meat.
Sí,
Well,
sí,
it's
la verdad
not
que
meat.
sí,
processed.
ajá.
Yeah, it's processed soy meats.
You know that if you consume, and this is a study that the American Cancer Society did, if you consume 3 times a week processed food, you have a 50% chance of getting cancer.
Yes, I heard that. Like a lot of it is like the weenies, ¿verdad? Que cada rato los grills y que the cookouts que tráete los weenies,
Un hot
all of
dog,
yeah,
estilo Juárez.
Yes, yeah, those processed meats is what she's talking about.
She just mentioned red meat. Yes,
Yes,
red
the
meat.
red meat.
It's it's tied to increasing colon cancer.
Why is there a lot of doctors? Well, not a lot, but I follow some doctors on YouTube. The lamentada carnivore diet, like they that's all they eat, red meat, todo eso, like
to prevent what or what?
to
I've
have
never
a
heard
healthy
it.
body. and lose weight. Y todo eso.
Wow.
Yeah,
I've
look
never
into
heard.
it.
Well, I've never heard of that, but I have heard because of my dad being sick, with the red meats and stuff. And then that's what I was told to help prevent it. Which of course you love a steak here and there, but yeah, I try to limit my consumption of red meat,
Y luego-
and it's mostly chicken and fish that I try to eat.
And the number one, my sister went through it también. She got diagnosed with breast cancer. Y le dijeron, the first thing you need to do es dejar el azúcar.
Yes.
Yeah.
Do not eat sugar.
Refined sugar, right?
Cancer feeds off of sugar.
Yes.
Wow. Look at that. So how many people would you say, or are the studies showing like diabetics also
Well, heart disease and diabetes actually goes
like
into
hand
cancer.
in hand? Oh, okay.
It actually, there's a correlation between that.
Oh, look
Yes,
at that.
there's a correlation between diabetes and heart disease.
Yeah, my
Is there a
dad-
website where we can get, more educated?
Cancer.org.
Really? For nutrition?
We
todo
even
eso?
have, we even have doctors that go into our cancer.org to look up studies and statistics when it comes to them providing this information to their patients. We have a dedicated portion of the cancer.org for everything. We have it for veterans. We have it for physicians. We have it for nurses. We have it for navigators. We have it for patients. We have it for survivors. We have it for caregivers. We have it for anybody. It's tailored to anything. I mean,
Wow.
yes.
Wow.
And we have an 800 number too.
Wait a minute. And how well do you work with? Because I know that when my brother, who also passed away, he had leukemia, and my dad got cancer. The Ronald McDonald's House actually helped out a lot. Are you all together?
We're all in the same field. We're not together, but because they focus a lot more. It's specifically just kids with cancer.
Yes.
The American Cancer Society focuses on all cancers, including childhood cancer. So we're a little bit of everything, but we work with organizations like the Ronald McDonald's, like Rio Grande Cancer Foundation, which is another great organization that we work very close because we don't want to duplicate services.
The Rio Grande is here in El Paso,
Locally in El Paso.
and
Yes.
it services any kind of cancer as well.
Any type of cancer as well. Yes, and they're local. They're a local organization. So they also provide information. They also provide services. But of course, they're not a national organization, so they're very limited. It's like, well, it's a local organization. Why aren't they helping? Well, because their funds do run out. Cancer is very expensive. The average cancer patient, and she may have seen it, and even with insurances, you're averaging about close to $100,000 minimum to treat someone with cancer.
I believe it.
Minimum.
No, yeah, I believe it. And Shorty, have you ever thought of doing something like that for that Rio Grande and helping them get funds?
This is the first time I hear of this. And earlier, like you mentioned, hotels as well.
Yeah.
Is that also here in El Paso? And which ones are the hotels that they provide?
So we also own our own hotels.
Wow,
Across
that's
the nation,
great.
and it's called Hope Lodge. We don't have one here because our treatment in El Paso is a little bit more limited, but we do see some where those services are in partnership with Extended Stay America, and so that's how we provide the hotels because we don't have one locally here. In Texas, we have one in Lubbock, we have one in Dallas, we have one in Houston. And where's the biggest cancer treatment center that everybody goes to?
Houston.
It's Houston. So they get to stay there for free. They get to, it can be a day, it can be 3 days, it can be 3 weeks.
Yes. They
So-
helped my dad with that.
Yes.
MD
So
Anderson.
and that's how we support, because even though you do get impacted locally, a lot of the times the local services can help for local, but cannot help for patients going out. So they might not be able to be like here. I can say, well, I have a patient that needs to go to Houston. We have staff in Houston, and we have the Hope Lodge, and we also have transportation there, and we have all this. So our programs are nationwide. So the patient gets diagnosed here. They got to go to Dallas. They got to go to California. We have it all over the nation. So it's not just limited, but local services, obviously take a higher impact, especially in El Paso because higher in uninsured population.
Wow.
And earlier you were mentioning about the mobile truck. Yeah. For next year's event, is there a possibility of us having it there?
Yes, for
And-
sure.
And it would just, the screenings would be just for women, or how does that?
So it's a mammo ban. It would be for women, but if there is a man that is, feels that they need to get screened based on their history or, things like that, then of course that could be a discussion because you don't want to deny,
Yes.
screening, at the end of the day. But that would be something that we can, Desert Imaging used to have their mammo ban. They no longer have it in El Paso anymore. But I brought the mammo van to one of our, actually it was a Clínica La Fe. It's an FQHC in El Paso. And so they also provide services for their employees and they want their employees to get screened. And so we brought the mammo van and we were able to get over 30 women screened. And so those are the things that we can do and we can bring them in for our next event.
Oh, that's awesome.
How about get a
Looking forward to
specialist,
that.
Shorty? Agarramos un specialist.
Sí.
Y ahí en el baño nos metemos todos.
en el baño que nos
Yeah, I was
chequeen.
gonna ask you,
Just-
Martha, what is the screening for men who think that they may have breast cancer?
There is no screening for men because it's if you think about it, it's close not 2,700 patients, right? That get screened. Even though they are diagnosed, it's still not a high,
rate.
diagnosis, and there's no screening guidelines for men like there is for women. And some people say, well, what's the screening guideline for other type of cancers? And it's very unfortunate that we don't. It's normally our screening guidelines fall in the process of breast cancer for mammogram, cervical cancer, colorectal, lung cancer, prostate cancer. So those are the main common cancers that we see. But now the American Cancer Society, with the whole research, we are looking at many other cancers that are coming to rise. Gastric cancer is a big one. Colorectal cancer is coming up with more younger people getting diagnosed. So we are looking at all that. What are we, and even by ethnicity, believe it or not,
Yes.
the Hispanic, and our research we have research and it's documented on cancer.org as well. If you want to go look at it, we have research specifically just for Hispanics, indigenous people. We have for even African American, things like that. So because everyone, our lifestyles are different.
Yes.
And, and our genes are different. And so,
What, Vicky, for your mom, was she already taking care of herself as far as her diet since it turned out to be like stomach cancer, ¿verdad?
Right. To be honest, no. Excuse me. To be honest, no. After she went into remission, there was a couple of scares a couple of years after that, but again, unfortunately, that's what the survivors have to do. They go through their yearly process and making sure that everything's good. But my mom loved to eat. And then she was
That's
de
me.
todo. I'm like, de todo. But, what happened for her when we actually, like the girls were saying, we know our bodies.
Yeah.
And at that time, we knew that something was wrong because they had changed her medicine for diabetes. And they kept saying, excuse me, no quiere salir. They kept saying that it was her medication that was making her have diarrhea, throwing up. And we're like, okay, it's a month.
Yeah, yeah.
The following month, the same. The third month, the same. So we're like, okay, there's something going on, And it was a little bit frustrating because we would take her back. Something's not right. Oh, it's the medication. Oh, and it's the medication. And, I'm not here to talk bad about doctors, but I feel that when it comes to our elderly, the offices that we take them to, they get so overwhelmed with patients.
Yes.
Granted, not all of them have cancer. They all have different types, of illnesses. But I feel like they get so overwhelmed with patients that they can't sit there and say, how are you doing today, Susie?
Yes.
And
I agree.
We went through that for almost 6 months. Almost 7 months. My mama was a big girl. She was weighing maybe a good 180. By the 6 months, 7 months, she was already down to like maybe 140. And we're like, just something's not right.
That was the biggest sign, the weight loss.
And it's obviously, people like Shorty that are doing our runs and stuff like that. But also, we had a nurse that came in and she was like, no quiero ser Pepa. She's like, but I'm going to be Pepa. She's like, do you mind if I look at her chart?
chart.
And we're like, yeah. So she looked at the chart and she was like, you know, it's sometimes I feel like you have to be a little outside of your job.
Yes. Yeah.
You know, I'm pretty sure you know where I'm going. You have to go a little bit outside your job to do the right thing for that patient.
Yeah.
And that's exactly what she did. She turned around and told us, like, it's already been 6-7 months. You know, you guys are not getting an answer. I suggest you go take her to a gynecologist. And we're like, really? Gynecologist? And she was like, yeah. You know, your mom still has her uterus, you know. At the time, I want to say my mom was about 71, 72-ish. And as then they told us, you know, take her. Just, who knows? You know, just to draw it out from what's going on. And we're like, okay. So my dad, you know, right away, my sister, you know, they took her to the doctor and stuff. So the doctor's like, well, let's just go ahead and do a preventative and let's do a hysterectomy. And we're like, really? And he's like, yeah, let's just do it. Let's just rule it out. So that's exactly what they did. That's where they found some cancer. So they did her hysterectomy and then they turned around and said, you know what? It's all full of cancer in there. And we're like, we knew it. And that's something that we kept saying to the doctors there, you know, that were treating her for diabetes. We were telling them, like, these symptoms that she has or, you know, that she's been having for 6-7 months. I'm like, she used to have these back when she had breast cancer. But then again, I was like, what do I know, right? It was just like, you just know. Like the girls were saying, you know your bodies, you know, and sometimes us, you know, as children, we know our parents.
Yeah.
You know, we know when they're not feeling good or we're like, something's off, like something. You know, so granted, by the time we did that, they sent her back to her oncologist. That's when they told us it was actually stomach cancer. So the cancer had already traveled to her uterus. And we're like, how did they miss that? You know?
Right.
And it's crazy because the gastric is very hard to detect. That's at least what the doctor told us at the time. And it was, you know, it gets involved with your intestines and, you know, down in the little itty bitty thing, like that's where the tumor was.
But you bring up a good point about, you know, the doctors. And it's not like they don't have the time to sit there and ask, but who knows their bodies more than us? You know, if I'm a doctor and you're telling me something's wrong, I don't feel, you know, it is my obligation to investigate further. But I think, and I was in the medical field as well, so it may not be that the doctor is not listening, but like you said, so busy and overwhelmed with patients, and there's not enough doctors, not enough clinics that can help. And it's kind of like, it sounds ugly, but kind of like a cattle call, you know, who's next? You know, I've been a patient and I can hear them. Que me toca, okay. You know, and they're like going in there and duras más esperándolo than when he's in there he takes 10 minutes and it's like, quick. You got everything good? Okay. And then they leave you off to the medical assistant or to the nurse that's there. And then you're just like, but I had questions, you know?
Yeah.
So, and it stems a lot from, you know, the funds that there is, you know, how many doctors are getting, you know, becoming doctors, you know, and I think, you know, the world needs more of that.
We definitely do. Like, I mean, right now the population for elderlies, it's so many patients out there, you know, and we definitely need more doctors, more nurses, or more of ourselves, you know, to go out there and help each other. And hey, you know what? You should get checked.
And do this. This is, like you said, bring awareness to help, you know, listen, you know, hey, well, this is what I'm feeling. And then maybe somebody's telling you and you're like, you know what? That's exactly what my mom was feeling. I really think you should pursue it.
Exactly.
In that way, you know, now that you see people and you say, that's my story. That sounds like my story. I would definitely push it and pursue it, and don't let the doctors just, you know, do nothing, you know. That's super important, you know, and people like these events, you know, I'm looking forward to it because I hope that people, you know, in the biker community and any community, because anybody's invited to these events, not just the biker community, but anybody in general that wants to support Shorty and the cause, the Kickstands Up, but to come out and feel free to ask questions. Are you going to be there, Marta?
Yes.
Oh, even
and
better.
We're gonna have the big giant pink inflatable chair.
Yes.
So people can go have fun and take pictures.
Is there a weight
You know?
limit?
I knew you were going to say something like that.
I was gonna say no, there isn't, because let me tell you, I've gotten that chair with like almost 15 people on top of it. I don't know how it survived, but it's still there.
Sí, ya ves, yo.
Ya me puedo tomar, ¿no?
Te vas a tomar un picture ahí en la silla. But yeah, that way, you're gonna get bombarded with questions. Are you ready for that?
And I'm ready. But I'm also ready because as survivors, I will say, be your own advocate.
Yes.
And what a better way for our survivors to share their story of how they got diagnosed, how caregivers can show, I was a caregiver once, and I tell people, cancer does not discriminate. I worked for the American Cancer Society, even though me knowing, but sometimes those barriers that the doctors misdiagnose you.
Yes.
The patient itself doesn't want to go get checked. I mean, there's a lot of many different factors. So people always say, well, that these organizations don't help. Well, there's more factors to it too. And that's why these events, help, because the awareness that comes behind it, and that's what it's more powerful.
Right. Yeah, absolutely.
You know what? And involving the whole community in this, I mean, it makes a big difference, especially like you mentioned, like deductibles being so high, insurance, and cancer being expensive. Last year we raised the money. That money went directly to my sister. And I want to thank the community, everybody that was out there involved. And, you never know,
Yes.
who's going to get hit with this. And we're out there, to help out as much as we can. But again, I want to thank everybody that does, come out to these events and they help out. The money that they give out, I mean, it's used for the cause.
Yes,
Absolutely. And my sister's here. I'm glad that we did that run for her. Unfortunately, my tia, we did the event as well for her, and she wasn't able to see it at all. But I want to thank the whole community because they come out and they donate, and everybody else that gets involved in that. I mean, God bless everybody. I mean, muchas gracias, and thank you for helping out my Carolita here. And
absolutely. Y siempre como lo ha dicho, no. I've said it before, ¿verdad, Joe? Like, hoy para mí, mañana para ti. It's you never know. Today we're helping this person, tomorrow we may be helping me. So it all comes like that full circle, and let's help each other. Porque in the end we're all familia, right? We're all familia.
One of the wonderful things here, this is one of the many reasons I got into the biker community, because we all come together. We have the bad, image that, es biker, es borracho, y esta tiene agua,
Sí,
no es ni cerveza.
Bueno, pues,
nomás me quería ver malo y le puse agua, pero
somos buenos borrachos, ¿no?
Yeah, somos buenos borrachos.
oiga, carnal, aventé una piedra, yo aquí estoy en la cámara y estoy tirándole unos tragos, ya me miré mal.
Pero es agua. Anyways,
yo me metí en la community nomás porque me gusta.
Pero, I mean, a lot of people that don't, mira, ahí está un ejemplo. Como dice Susie, you don't have to own a bike. I mean, just come out and support. I mean, and be a part of it. Be a part of it.
Absolutely.
Y como dices tú también, Susie, hoy por ti, mañana por mí, ¿o cómo?
Yeah.
Algo así, por ahí va.
Exactly.
Pero sí es cierto. También otra cosa que quería hacer is that sometimes when you don't have, like my mother-in-law passed away de pancreatic cancer, and that opened our eyes like big time. We saw her, no más duró como after she got diagnosed. También es una pregunta que tengo. Why, si saben que es cancer, why are the doctor appointments so far away?
Unfortunately, we don't have the sufficient amount of oncologists in El Paso. It's very unfortunate. But as you see, Texas Tech is looking at opening up a comprehensive cancer center.
Wow.
What you mean by comprehensive cancer center is a big variety of services that are offered in bigger metro areas that El Paso doesn't have, which is amazing.
Yeah, that is.
And so maybe that'll bring a Hope Lodge to El Paso, right? So yes, so that's the reason why. And you do see appointments far off. But let me tell you another reason why you're seeing a lot of patients getting diagnosed. And we're going to see this in the next couple of years, guys. The pandemic took a toll. And a lot of people did not get screened. And so we're going to see those effects coming in now with late stages or people barely trying to get screened or, you know, things like that. And so we are seeing that, that part of our statistics are showing a lot of those missed opportunities from the pandemic. And we're still continuing to see it. And that's the reason why we're funding hospitals with these programs for screening, because we want to make sure that we tackle it right away versus them waiting for us. No, the nurses and the social workers and the navigators are going out to their patients and asking them, have you gotten screened? No, I don't have insurance. Let's get you screened. That's the whole method behind these screenings that we're offering to our hospitals.
And how soon are you guys looking into bringing those clinics that you just mentioned?
Oh, it's already happening.
Oh, is
yeah.
it?
Like right now we have a lung screening. Lung screening is up in the rise right now. And it's a very deadly disease. And you don't hear much about lung screening, but we have a lung screening program with Hospitals of Providence right now. And that, yes, and it covers patients who don't have insurance. And so I work very close with the navigator to help look for patients that need to get screened and help them quit smoking. You know, because of course, smoking is one of the reasons why, you know, lung screening is, you know, lung is developed, right? So that's what we're doing right now. We offer across the nation, you know, breast, cervical, and then we have another clinic for HPV vaccination for kids to get vaccinated. And, you know, that prevents 6 different cancers in their future. You know, so things like that. So we offer those type of services. And of course, already the breast and, you know, cervical and things like that are already happening. But that's what we're doing right now, and it's directly working with hospitals.
I really hope that these events, Shorty, that you're doing become a great success and they get bigger and bigger to bigger venues, you know, and it gets out there in the media, in the news, so that more people can support, so we can continue to have these programs, because these are going to be great help, you know, to the community. That's something I didn't even know. And that's great, because, you know, survival rates are going to increase because of this. So I'm definitely down to help you, Shorty, to do whatever we need to do to make these events a big success and make them bigger every year as the years go by, and get not only the biker community, but everyone in general, you know. Let's rub elbows with, you know, with the elite, you know, you know, bring us together. I think that would be a wonderful thing, you know. Everybody knows somebody that has had cancer or has lost somebody to cancer. So why not? Why not come together? You know, everybody may know somebody that knows somebody. You know, bring your resources together to make these events that much successful. Right. Why not? You know,
I'm excited. You know, I'm hoping a lot of people come out, and Martha is going to be out there and giving information. And this is important information for us as Latinos, or ¿verdad? And anybody, because cancer it's really hitting hard.
Yes,
you know.
I agree.
And it's not a death sentence.
So yeah,
I think that's important to know. Yeah, because everyone feels like it is.
It is.
You know. I know, like, even like my mom's like, no, ya le de cáncer. No, pues ya. You know, it's like she's already, you know, ya lo está enterrando, velando, and I'm going, Mom, you know. But that's my mom. It's the mentality, you know, that the old school have, that, you know, your cancer, good luck, you know. You know, it's not like that anymore. You know, there are, you know, big survivor cases that, you know, and all of this that helps, you know, the survival rate increase. Right. So, thank you, Shorty.
Well, we're definitely excited to be out there.
Yes.
Again, danos la información otra vez, Shorty.
Okay.
Porque no tengo mis lentes.
Let me grab my... Yo sí me los puse porque no miro. So, this is going to happen October the 12th, guys. And it's going to be from 12 p.m. to 6 p.m. And it's going to be at the American Legion Post 598 on 141 Ellsworth. That's up in Horizon. Entry fee, again, is $15 single, $20 couples. We're going to have, or we already have, raffle tickets going on out. First prize is $800 cash. Second prize is a 70-inch TV. And of course, we're going to be having door prizes as well there. $3, I believe, a ticket. And we got a DJ, Miss Fee. She'd be playing out there for us. She's donating her time as well. Awesome. Everything that we get is donated, except for, we help our veterans there. And we have that event there because we're helping them as well. They're going to be selling beer, adult drinks, sodas. And then, of course, we got Big Dog Food Truck. I mean, he's got excellent food. Está machine el guy.
Are you accepting any donations? Like, si no puede ir la gente, can they contribute to the cause?
Yes, absolutely.
How would they do that?
Well, I have my phone number. You can give me a call. It's 915-503-8440. And my wife Terry, but she's the one handling all that. And I'll just pass her the information, and she'll, write you in and
so
whatnot.
ella es la que me escribe los boletos de raffle cuando te compro.
Ella mero.
Okay.
Thank you, Terry, for all you do.
Yeah.
Oye, qué bueno que no estás rifando algo de los Cowboys.
No
hombre.
empieces,
Ya cambié de Cowboys. Ya cambié de Cowboys.
We're not going to talk about the Cowboys.
No, pero Shorty, in all seriousness, thank you very much for por lo que haces por la community. It's está muy fregón lo que haces.
Very much.
Y siempre, this is your third time. I hope I see you more para darle más, especially the awareness.
Yes.
That's very important.
Oh, yeah.
Nosotros los mexicanos nos duele algo y
Échate Vic.
échate Vicks, lo tiramos al león. y así podemos andar un mes con un dolor.
Oh, yeah.
And we don't pay attention, to it. So I think, this, again, it's cancer, www.
Yes, www.cancer.org.
.org.
Or they can call our number as well, 1-800-227-2345. And Spanish speakers, English speakers, we have Chinese speakers, we have translations like up to 30.
Wow.
So
What
just
about the
so you know.
website? Is there an
It's
option?
Spanish. Mhm.
Oh,
on the
they have-
corner, it has an option for Spanish.
Nice.
And it translates everything into Spanish.
Oh, nice. See, that's great. That's
So
good.
there's no reason for you not to go visit the site, get some information, eat healthy. Ahorita que estaban diciendo eso, muchas veces, yo no sé si it's the economy o qué, pero sometimes for our kids, pinche Winnie con huevo. Y ahora que mi hijo ahí está. Y no sabemos el mal que le estamos haciendo, like we don't take that time.
At McDonald's.
At McDonald's, ajá. ¿Cuántos no?
A double-decker bologna sandwich. Go with it. No, man.
And it's true.
We don't pay attention to
the
it.
whole, everyone, how many people tienen cocina y no la usan? It's not like before que, su sopita, your
¿Estás
food.
oyendo, Linda?
Hey, leave Linda alone. Pero it's true, we're all busy and all going nowhere, ¿verdad? Getting off of work y I'm too tired, pues I'm going to go through the drive-thru y le compro unas papas fritas, whatever. And that we know it's not an ideal diet,
Right,
and the doctors have said it time and time before, it's just maybe once in a while, okay, treat the kid, whatever. But people are not making food at home. It's not. I know I recently started to pack my own lunch, do my meal preps, and packing my own lunch because, and I feel better. I'm not when I'm done with lunch, I'm not like falling asleep, at my desk or whatever. I'm able to, I have that energy because of the lunch I provided myself, and I'm not tempted to, las French fries, whatever.
Yo no sé, no es cierto, Susi, porque todos los Tuesdays pones Taco Tuesday y que los tacos y todo eso. So, I don't want to throw you under the bus, pero
there's some healthy tacos.
They're homemade.
I always tell people, all to moderation.
Yes,
Yeah.
That doesn't mean you have to eat the whole buffet tampoco, okay?
Instead of eating 4 tacos, eat 5.5. Not just no. But I want to add to that because it's really true, But mentioning as a survivor, the nutrition, keep in mind that, there are options out there, and when you said financially, it is a very common thing we see. Patients going through cancer can't eat healthy because they can't afford it.
Exactly.
And that's another topic where we fund those type of grants, to organizations like that, because financial toxicity with cancer patients, it's a real thing, and so eating healthy can be something that they can't afford.
Yeah, right.
But there are options. So I tell people, if you go to McDonald's, get the grilled chicken.
Yeah, grilled chicken.
You know, don't get the fries.
Yeah.
Get a side of a salad. You know, but those are options that we just don't, you know, she said, I eat chicken and we just don't think of those changes for the better of our health.
Yeah.
You know, but there are options out there, guys. There is, you know, it's just we choose not to because it's easier. One or two, it's less expensive.
Yes. Yeah,
You know
and
what we should do?
that's what I was going to
We
say.
should do a cooking show.
Yeah, I thought we were gonna have that cook on the show. We need to bring him on here so to help like the community, and there's nutritionists out there that help you make a better choice. So you're gonna go to McDonald's, you're gonna go to Burger King. There, believe it or not, there are some better options on any menu.
You know what?
There.
And especially young moms. You know, the easy way.
Yeah.
Un pinche I'm sorry. A un McDonald's y vámonos, nuggets, órale, mijo, vámonos. Y ya
let's
cállese.
go. Yeah.
You
That-
know?
Even at home.
Yes. Yeah. Even at home, you know, and it goes back to, you know, here's the laptop, here's your Cheetos y los hot Cheetos y vámonos. You know, and it's like, that's that, you know, we've all come to that. And I think it's going back to the basics, you know, because as a kid, I never got Cheetos like that, you know.
Yeah,
you know,
or the-
comía los frijoles y la sopa o nada, you know, it's like,
Yo me iba a comprar un menú ahorita, Jamaica, ¿no?
You know what? Actually, como mis abuelos vivieron una larga vida, pero vivían en rancho.
sí.
So
sí.
so muchos dicen like it's what they ate. You
Yes.
know? No, ellos no comían like
Yeah.
processed foods y nada. Era frijoles, papas.
Sí.
Most of the things that they would
Yeah.
you know,
and the
que-
animals weren't injected with all of this
No,
stuff, you know,
no.
just, the hormones. Yeah.
Have you noticed the hormones? Well, all this meat, right? Injected with
Yes.
hormones. Have you noticed a young woman, 14-year-old, back in the 90s, right? 80s, 90s. And you look at 14-year-old now,
Yeah.
she looks like she's 30 developed.
Yes.
I mean,
yes.
what are we consuming?
Yeah, exactly.
Also, cuando comienzan su period, ya no me acuerdo que, you know, comenzaban, they started at an early age nowadays que antes, you know?
Oh, my daughter
Yes.
started at 10.
Yeah.
See? Yeah,
you go.
and it's true. And it's true, but you can see it in the food. Like, you have your medium-sized egg, big egg. Eggs only come in one size.
Yeah.
You know, they do. You know, I had chickens on a ranch, and so they only come in one size. So if you're getting bigger, think of why it's bigger. You know, those poor chickens are being put through hell, you know, and then we're consuming that. And that's, in essence, is what damages our bodies, right?
But hopefully we can do something else to bring, me está gustando esto, you know, maybe some, I don't know.
Yeah.
Nutrition.
Maybe
you know.
welcome Martha back because you're just.
Yeah,
I
Martha
I
también, Martha.
poking at you. You know, it's
I
like
know.
picking apart of the brain. you know?
Practice what I preach first.
Yeah.
Whenever you
I
want.
can bring someone. I can look for someone because there are
like a
nutritionists
nutritionist.
in hospitals that work with patients.
Okay, yeah.
You know?
So look forward to that episode, guys.
Yeah.
That we can bring Martha back, and
Absolutely.
then bring some nutritionists. You know,
Maybe some easy recipes o algo para las
Y para
young
probar
moms.
aquí a ver si.
Sí.
A ver
Que nos
si
gusta
sí
comer.
que- Yeah, exactly. I mean, 'cause I'm with your mom, yeah.
Yes.
I love to eat, and digo yo, bueno, I'm gonna die anyways.
Yeah.
And, you know, because it's so good.
I'll
'cause-
start on Monday.
Yeah, and Monday never comes to that.
Y nunca llega.
Yeah, y nunca
Yeah.
llega. Exactly.
Pues, before we close, Alex, we got a little. This is our Psycho Uncensored Cancer Awareness edition design. So.
Nice, thank you.
Nice. Sí, para cuando venga otra vez,
Yeah.
Marta.
I'm gonna wear
I'm 49 today.
But I'm gonna be next time uncensored.
Sí, ah, there you go.
Thank you.
Yes,
Thank
thank
you
you.
so much.
Those are nice. Te avientas. Te avientas.
yeah.
It's your business. ¿verdad? El Lucky-
It's my side hustle.
Sí.
That's great.
Yeah.
Joe and Linda, they were hustlers.
Todo le pega, ¿no, Micho?
A todo menos
Oh,
a la
come on.
lotería.
I was just going to say that. Yeah. Ni yo.
Hey, one day, but you gotta play. Yeah, you
Yeah.
can't
Oh,
win
I
if you don't
do.
play. You do?
But yeah.
Pero
Oh, a buddy of ours won.
really?
One of our constables.
el que ganó aquí en la gas station de Socorro.
I'm not sure if it was, where was it at? 2 weeks.
Oh, really? Oh, okay.
Yeah.
El que no se ha visto.
El
El que
angel.
no se ha visto.
Yeah, $150,000 le pegó.
Wow.
Yeah, that's awesome.
Amen.
And
What a
congratulations
blessing.
to him.
Yes.
Awesome.
Yeah, he's an awesome dude.
Congratulations. Pues any last words you might want to?
Yes, I want to go ahead and thank everybody that came together to help me getting through my ordeal. The money that was raised, with my brother and his team, it was amazing, and it helped out. Everybody thinks that we have insurance and that the insurance should cover everything, but it doesn't. Any little bit helps. And again, thank you all for your support and for being there. It got me through, and to my family for being there and helping me stay strong.
Love you, Carnala.
Amen.
Amen.
Thank you. And, not only as a representative of the American Cancer Society, but I think I have built friendships, with Shorty and Terry, and, and now seeing how it's been impacted, that, how they want to help the community. I can't thank them enough for supporting a cause and whoever they support, right? Because it can be us, an organization, can be a different organization, but the fact that they're helping their community and helping, like mentioned, the financial toxicity that comes along with the diagnosis, just the care that they give to their community members, and the awareness that they're going to bring. And I can't thank them enough, because if we can save one more life, that is an impact in general. So thank you so much for this.
No, thank you. Thank you for what you
aquí
do.
tiene la puerta. This is your house. Or if you have a message, we're more than happy
We
to have
love
you.
to have you back.
Yes, of course.
Yes.
Anytime, let us know. And, we cover all types of cancers, all type of awarenesses and information. And I can always, if you need somebody who's in the field as a specialty, definitely, because that'll also help us bring more awareness too, for them to have a successful, event every year going and going.
Yes.
For men.
Yes.
Yes,
Algo for men.
yes.
Para quitar ese machismo.
Yes,
yes.
exactly.
Mira,
agree.
Alex es uno de ellos. No, hasta la sangre, hasta la sangre.
Hasta la-
No, mijo.
Yes. But again, thank you to your podcast for letting us come out here and obviously bringing out awareness, bringing out my prima that has actually survived it and still fighting. And of course, primo, to my mama, even though she wasn't able to see it, she knew.
She's watching.
She knew, and she loved the Almanzares very, very much. But yes, the money that you guys raised for the family helped my dad a lot. And you're right.
Gracias a Dios.
It goes a long way. It really does. And he's a man of very few words, but I know that he's very thankful as well.
Qué bueno.
And I'm sorry.
No,
And
you're good, you're
granted,
good.
we're talking about breast cancer because October is breast cancer awareness, but definitely any type of cancer. We really need help to get out there and be our own advocates out there.
I want
Thank you
to
guys.
thank my vieja, because I was kind of, quería ir a pegarle al sofá and kick back after the last event. And she said, no, we have to do something, and we have to do something for Sylvia and your tia. And it's October. It's Cancer Awareness Month. So, babe, thanks for
Good job, Terry.
Thank you.
Terry.
Thank you,
for
Terry.
pushing me,
No,
pushing
you're
me.
not going to sit down. Ándale.
No.
You got more
A
events to do.
chingale, ándale.
Hey, what Shorty does best, ¿verdad?
So,
Alguien
here
tenía
we
una.
are.
Somebody had a story right now. I kind of overheard, because this show was supposed to be recorded last week. You want to?
Oh,
Yes.
yes.
You
wanna mention it?
Tell us.
Yes.
So ironically, and I always said, I lost my mom to cancer 13 years ago, and she had bladder cancer, and we were supposed to be here last week, right, on
Yes.
Sunday, and when Shorty called me and Terry called me, and they're like, we're gonna reschedule for next Sunday, and I'm like, oh, let me look at my calendar. I'm like, wow, it's my mom's birthday today. Happy heavenly birthday,
Happy
my mom.
heavenly birthday.
Yes, and so and it also reminds me, and I think it adds a touch aside from the how I love what I do. But I think for our survivors and those we've lost, because let's not forget those who we've lost, right?
Yes.
And they actually also drive us to go ahead and continue the work that we're doing, because we don't want another patient to hear the words, aside from you have cancer, but there's nothing we can do.
Yes.
That is very commonly heard, and we don't talk about that very much. And so that is also a way of showing our community that that's what we're thriving for too, and what we're going for. So happy birthday to my mom up there. She would have
Happy
been
heavenly
68, but I know
Happy
she's not
heavenly.
suffering. And so thank you. It was a calling as to why I had to be here today.
Today, yes.
Awesome.
Aw.
Awesome.
I got the
bonito.
chills cuando lo oí.
Qué
Dije, wow.
bonito, yeah. Qué bonito.
Bueno,
Pues
there
thank you.
have it. Don't forget, what date is it?
October 12th.
October the 12th.
October
So,
the 12th.
hope you all come out and join us. Have a good time. Do a little bit of dancing there with Miss Fee, the DJ, and sit on those inflatable
Pink
chairs.
Pink chairs.
Sí.
So
No
thank
weight
you.
limit.
Yeah.
We'll see you out there, Raza. We'll see you out there.
Thank you very much. We'll
you.
see you next time.
Later.